I want to officially welcome you to this second webinar in the Child Abuse Prevention Month series. My name is Jessica Matley. I'm a training coordinator and facilitator with an OCAP grant-funded statewide program called the California Training Institute, but our friends know us best as Caltrin. And we're excited to be here hosting today. I will be serving as your moderator and as your MC. But before we get started, we are actually more curious to know who else is in the room with us. And we are in a webinar, which means we can't see you, but I can feel you from a distance. So if you would please, in the chat, let us know where you're visiting from. So that might include your name, your organization, maybe what county you're in. I'll see these start to roll through. Welcome. So I see all the way our friends in the north, Sonoma, all the way in Southern California, Orange County. Welcome. Great. Thank you all for doing that. Sacramento in the house. Welcome, everybody. Now, I'm always just curious to know if you attended the first webinar or saw a replay of it, why don't you give us a reaction? You can either do that in the chat or you might see a reactions button at the bottom of your screen. Oh, great. You found the button. Wonderful. Well, welcome back. Every week, as you know, in the month of April, there will be a new topic. And of course, this series is centered around connecting communities. This session, we are joined by 3 guest speakers and panelists that are going to provide their perspective on today's topic, which is equity in action, prioritizing community supports. And of course, we look forward to engaging with you on this topic and learning from our presenters. So let me give you an idea of what exactly you can expect today. We are going to have, as I said, 3 presenters and panelists who will be introduced when we get there. We will also do a brief panel discussion where we will ask some questions really around today's topic. And of course, we'll close it out. Now, something to note is we do have some note-taking slides. So if you're a note taker like me, there is a spot in the chat for you. There is a link, actually, it's a PDF document. And if you click that document, it'll open up some slides you can follow along with. That'll kind of keep you organized this morning. You should also note, because we are in webinar format, you are not able to see yourself or the other attendees, but you can see the panelists today. However, you will have an opportunity to engage in the chat. So if there is something that you have a question about or a comment that you'd like to add, you are more than welcome to do that. I will tell you that today's session is a full hour with the panelists and their presentation. So what we would encourage you to do, actually, if you have a question, at the bottom of your screen, you should see a Q&A feature. If you have a question related to the content, we would recommend that you place it in that feature. Although we may not have time to do a Q&A at the end of today's session, those questions will be reviewed and responded at a later date. With that, I would love to get us started into today's topic. And to do that, I'm going to introduce our first 2 presenters. So in today's, as I said, we have 3 total, but I'm going to be introducing the first 2, Renee Velasquez and Maya Burke-Hill. Renee is the Director of Health Initiatives at the Child Abuse Prevention Center. She passionately advocates for public and mental health, committing herself to develop holistic support systems that enhance family well-being and resilience. Holding foundational degrees in human service management and psychology, along with advanced studies in clinical mental health counseling, she brings a deep understanding of the complex facets of health that underpin thriving communities. As both a mother and a step-parent in a blended family of 5, Renee draws on her personal experiences to fuel her professional mission. She champions accessible, comprehensive support systems that enable every family to thrive. And I also want to introduce Maya Burke-Hill, who is the Senior Family Health Advocate serving Black mothers through Black Infant Health. Holding a degree in health education, she has a passion for helping others make healthier lifestyle choices for themselves, their families, and their communities. And with that, we want to say good morning, Renee and Maya. Thank you for being with us, and we're excited to hear what you have to say today.
Thank you so much. Good morning, everyone. I'm Renee, and thank you for joining us today. We're gathered here to shine a light on a critical issue that impacts the heart of our communities. As we embark on this journey together, let's confront the realities faced by Black mothers and their babies with courage and determination to make a difference. Did you know that health disparities affecting Black women and babies appear less dependent on age, economic status, or education? Even with optimal conditions, for example, pregnancy at an ideal age, high income, or advanced education, poor birth outcomes persist among Black women. Alarmingly, Black women are 4 to 6 times more likely to die from pregnancy-related causes compared to their peers of other racial or ethnic groups. Furthermore, Black babies are twice as likely to be born with low birth weight compared to infants of other racial or ethnic groups. Today, Maya and I are here to guide you through an overview of the Black Infant Health Program, showcasing the comprehensive services we offer and illustrating how these services directly address the disparities I highlighted. Our presentation will delve into our program's approach, including our prenatal and postpartum group sessions, our emphasis on building protective factors within families, and our strategies for fostering resilience and empowerment among Black birthing people. By the end of our time together, you will have an understanding of how the Black Infant Health Program is making a tangible difference in the lives of Black mothers and their babies, contributing to the broader movement towards equity in maternal and infant health. Next slide, please. The Black Infant Health Program is focused on addressing the problem of poor birth outcomes and health inequities affecting Black birthing people and their infants, such as chronic stress, social isolation, limited access to services, racial inequities, economic hardship, and disempowered communities. The program is designed to empower Black birthing people through shared knowledge, community support, and targeted interventions. We offer 10 prenatal and 10 postpartum group sessions coupled with one-to-one support services. Our group sessions are designed to serve as a foundation of support, education, and empowerment. Each session is thoughtfully crafted to address the unique needs and challenges faced by our participants, fostering a space where individuals can learn, share, and grow together in a supportive and culturally affirming environment. Our prenatal group sessions focus on preparing expectant mothers for the journey of pregnancy and childbirth. Topics covered include understanding prenatal care, recognizing signs of pregnancy complications, nutritional guidance tailored for pregnancy, stress management techniques, and preparation for labor and delivery, as well as interactive activities and discussions are structured to build knowledge while reinforcing the importance of self-care and mental well-being. Then we take a shift to navigating the postpartum period with our moms, with an emphasis on both the mother's and the infant's health. Sessions cover a range of topics, including breastfeeding support, infant care practices, postpartum recovery, and coping strategies for new parents. Additionally, these sessions address the emotional transitions of parenthood, of offering tools for managing stress and building stronger family bonds. Across all of our sessions, prenatal and postpartum, a key component is the emphasis on empowerment and resilience. Participants are encouraged to share their experiences and learn from one another, creating a community of support that extends beyond the program. By focusing on the strengths and resources within the community, the sessions aim to build resilience against the systemic barriers that contribute to health disparities. The group sessions also serve as a platform for connecting participants with local resources and services, ensuring that families have access to the support they need. Whether it's connecting with healthcare providers, accessing nutritional programs, or finding local parenting groups, these sessions help bridge gaps in services and support. Next slide, please.
Good morning, everyone. I'm going to be talking about the BIH goals of our program. So the whole point is to improve infant and maternal health for our moms by promoting health knowledge and healthy behaviors. By doing this, we can increase the ability for them to develop effective stress reduction strategies. And then we also want to make it a point to decrease the health disparities and social inequities amongst our community. And we want to empower our moms to build resiliency, promote social support and healthy relationships, connecting them with services, and then also engaging the community to support our Black families and their health, as well as their well-being and education through our outreach efforts. Next slide, please. So things that make us unique, we do go beyond the traditional health education approach. So we are able to meet with our moms one-on-one. It really helps us build rapport with them. We can hear things firsthand, their experiences, and with all that feedback, we're able to address the common factors that contribute to the poor birth outcomes that Renee mentioned earlier. So on the next slide, we're going to be talking about our 3 parts to the intensive focus that we have. Next slide, please. So the first one is reducing stress. So this aims to improve their overall health for our moms and their families. And by doing this, we help teach them different reduction exercises. So we really hone in on self-care. We practice gratitude circles in our groups. And then we also want them to learn strategies for healthy nutrition and then physical activity. And then for our social support, this is going to help them buffer the negative effects of stress. So we're encouraging them to develop and sustain supportive and strong social connections. We're able to do this in our prenatal and postpartum groups. They're able to be around other Black moms, but we also encourage them to build their village outside of our program. So really thinking about who they can include in their lives, in their children's lives. It can be family members, friends, coworkers, community members. It just all helps them develop more effective interpersonal skills. And then lastly is empowerment. So this is going to help make and sustain the healthy promoting choices that we're talking to them about. They're going to learn how to set and achieve personal, meaningful goals, both short-term and long-term. We're building awareness for personal strengths within them. They're developing stronger positive connections to their cultural heritage. And then they're also making progress toward positive behavior change. And then I am just going to hand it back to Renee for a few closing remarks.
And just to add, our eligibility requirements for the Black Infant Health Program, as they must identify as Black or African American birthing person, be 16 years of age or older, pregnant, or up to 6 months postpartum. And so as we conclude, let us carry forward the message that through education, support, and community engagement, we can confront and overcome the health inequities. Let's ensure that race and zip code no longer determine a family's health outcomes. Thank you for joining us in this essential conversation, and let's continue to work towards a future where every Black birthing person and infant thrives. Thank you. And Jessica, I'm going to hand it back over to you.
Wonderful. Well, on behalf of the attendees, which I hope you can see these reactions that are starting to come across the screen, we want to thank you for this information. And for anyone that is wondering, like, I wonder where I can get more information about it, you might have noticed that there's been some links dropped into the chat. Those links will also be summarized in an email that you'll receive in about 2 days with a copy of this replay. So just wanted to make sure I mentioned that. All right, so I would like to also introduce our third presenter today. Let me move us to the next screen and I will give you a little bit of information about Alex Fajardo, who is our third speaker. He has served as Executive Director of El Sol Neighborhood Educational Center since March of 2003. He brings over 30 years experience in community empowerment and has demonstrated a passion for building the capacity of individuals and organizations to improve health outcomes. Mr. Fajardo holds a master's degree in clinical psychology and has a track record of designing and implementing successful community-based programs targeting individual, family, and community change through health education and outreach programs using the community health worker promotores model. I will now turn it over to Alex.
Thank you, Jessica. Happy to be here this morning to share about this model. Actually, I will be presenting today about this model about community health workers or promotores de salud and how we can integrate it in our operations, especially because this model is a movement that has healthy equity lens in everything that we do. So I'm happy to be here. Let me share a little bit of who we are. Can you go to the next slide, please? So we are a community based organizations founded in 1991. And everything we do in our agency is with community health workers or promotores. We have community health workers in our board. We have community workers in our leadership, and we serve the region of the Island Empire directly providing directing services, but also we do training and technical assistance across the nation. Next slide, please. Really, our vision is really how we can use this model to transform communities, in other words. So how we can use community health workers, and we're going to be sharing a little bit of who they are, really that they can be kind of the center of the change in their own communities. Next slide. Related for our focus, we do a lot of training and technical assistance for CHWs, and we have trained more than 400 entities across the nation, and we believe that this model is one of the most effective models to really building healthy communities and getting social justice in place in everything that we do. And we develop training and technical assistance for many other entities. Can we go to the next slide so we can enter to our. So I think that the first question that we want to respond is, what is a community health worker and promoter? Maybe you don't know. And we are going to be sharing this video that share really who we are. You can go to play the video. Thank you.
We are working for health justice every single day. We are community health workers, born not made. We are working for health justice every single day. We are community health workers, born not made.
Here's our mission, to strengthen our community, working together with love and in unity, all around the world, all around the nation, community transformation.
We are working for health justice every single day. We are community health workers, born not made.
We know firsthand what you're going through. We got lived experience, we've been there too. We got empathy, and here's the best part, we're giving it all our heart.
We are working for health justice every single day. We are community health workers, born not made.
When systems are hard to navigate, when people need someone to advocate, when we see a pattern that needs to be changed, we are community health workers, community health workers.
We are working for health justice every single day. We are community health workers, born not made. We are working for health justice every single day. We are community health workers, born not made.
Thank you, Jessica. Yes, we are community health workers. We are born, not made. So one of the uniqueness of this model, we're implementing across, including serving our families and children's 0 to 5. We use community health workers. Really, this is not like a training. Someone just take a training and you become a CHW. This is really a vocation, a calling. That you have a passion, the heart to help the community, and that's why they are so effective. So they build the trust between the community and the system. They informs, they empowers the community. They connect to resources. And we have CHWs from many and different titles. They can be called health navigators, health educators. They can be called promoters. They have many titles, but the reality is that this is not about the title per se. It's really about who they are, and they are people from the community that speak the same language, that care about the community, that understand the needs of their community, and that's the reason what they are so effective. Next slide, please. So one of the roles of the CHWs is really how they can be kind of the bridge between the health systems and the community, especially when so many of our families or our community, they don't understand the system and how to navigate. So they need to understand both sides of the sides, the community, but also they need to understand of the health systems, really with the goal to transform systems, really to understand, be part of the systems, but not just to navigate, but also to how they can transform the systems they are working in. So that's super important. And next slide, or please. So this one is kind of we use it a lot of kind of understanding from the prevention spectrum prevention from the individual level to the policy level, but also they play different roles. So for example, we have CHWs or in our agency, they are educators. So they go to the families, they do the health education about prenatal or postpartum or any topical early interventions or school readiness. And but the goal is that they do the intervention at the individual level, but they need to understand the policy, how this family can really mobilize when I'm doing my daily work, how I can open the eyes of the family to go to the policy level. So how you can mobilize communities to transform their own communities. So we have health navigators, CHWs that work in chronic disease management, topics like nutrition, diabetes, asthma. We have care managers or case management, kind of being supervised by the licensed person, but they are the ones doing the family case as well. And also we have the clinical liaison and care coordinators, or CHWs that are working in clinics along with the doctors, part of the healthcare team, and being part of the same team to develop strategies to the care plan. And also we have CHWs that they do advocacy and community organizing, so they mobilize communities. So they play different roles, and this is some of the approaches that they can take. But if they are working as educators, or as a care workers, or as a chronic disease management, the idea behind of it is mobilizing people from the individual level to the policy, because most of the issues that we live in our community or that we're facing is about bigger issues that are happening that sometimes we don't have it. Next slide, please. So CHWs change after the COVID. COVID reveals the power of the CHWs. When you saw the COVID came and everyone was kind of needing services and getting scared what happened. So government understood the CHWs are super important, and that's super important. So COVID changed, and right now in California there are a movement on CHWs initiatives because COVID. So COVID really reveals the importance of the CHWs in our communities, in our agencies, in our interventions that we do. Next slide, please. So we share values. This is my last slide. We believe that CHWs are community experts, and they need to be treated as experts, even though maybe they don't have a high school diploma. Maybe they didn't go to university to get a master's degree, but they are good developing relationships in our communities, and we treat them as experts. We believe the CHWs, promotores, go beyond of services providers or navigators or coordinators, so they do more than just a service provider. They are there really to mobilize communities so they can find their own solutions and what they want to do. We believe the CHWs transform systems and structures, and they serve as agents of change in their community transformation. So this is not just someone that I'm gonna hire to do my visit to this family or to this intervention. Really, they are more than just providing services. The idea is that they can transform my own systems in my own entity. And I think one of the things that having a community member part of my team is that they can tell me what I'm doing wrong and what I need to fix. And sometimes we don't like it as a manager, so as a leadership in our agency. But having a community member that maybe they don't, but they live in the community, they understand what they are facing. And when they are part of my team, I need to be open to hear from them. Hey, Alex, you guys are doing this. How you did this intervention? How? And that's super important, having a community member part of my team and validating as an expert and transforming my systems. And we believe that we could learn and could teach, so I can learn from them and they can learn from us. And there is no group that knows more than the another one. All of us have knowledge that we can improve our interventions. So thank you so much for the opportunity. I will be sharing more in the questions later on.
Great. We want to say thank you so much, Alex. And I feel like participants were really loving that video. I saw a lot of emojis come across. I thought that was really fun. And again, just for anyone on the call, just to remind you that the resources, the YouTube link and things of that nature are found in your 2-day follow-up email. So what I'd like to do now is transition this conversation. We've had a chance to get to know our speakers, hear a little bit about their programs, but now we want to explore some questions. So this is going to be a panel discussion. I have a few questions that we're going to review all together. And these questions, again, are centered in our dialogue today about equity in action, prioritizing community supports. So the 3 panelists, I'll pose a question, and we're so interested to hear your thoughts about it. The first question I have is, how did you identify the needs of the community you serve? How do you ensure you're meeting the needs of your community ongoing?
So basically the establishment and ongoing evolution of the Black Infant Health Program has always been driven by a deep, genuine understanding of the community needs. It's informed by rigorous data analysis and a genuine community engagement. And so initial needs were identified through a combination of health outcome data, stakeholder input, and a historical understanding of health disparities faced by African-American mothers and infants. For instance, a comprehensive report was completed called Centering Black Mothers in California, which is one of the links that is going to be dropped. And this pivotal report draws on the insights of Black women leaders and community members, offering an in-depth analysis of the factors contributing to these disparities. So based on that data and community input, it provides a crucial findings and recommendations aimed at improving the health outcomes of Black mothers and babies. And I'm going to let Maya tell you a little bit more about some of our more internal ways of doing it as well.
So the part of how we ensure that we're meeting the needs of our communities, given that Black infant health is statewide, it's spread across 14 counties in California. So us specifically in Sacramento, we're able to provide different things compared to other counties, and whatever our site can't do ourselves, we make it a point to go find somewhere in the county that can. And how I mentioned, we have one-to-one access with our moms through case management, and in the group part, providing them different supportive items. We're actually able to get feedback straight from them. So it's giving us feedback from the community. They can let us know what they like, what they don't like, and then our areas that we can improve upon.
Wonderful. Alex, I know you might have had a thought as well.
Sure. I think one of the strategies that we use for is having the community part of the conversation. So we invite this community member, this mom that has been in our programs for many years. We identify her like a leadership, and we invite her to be part of this community health worker promoter, part of my staff, so they get paid to be part of it. And they are the ones who are guiding us in that process. That's one of the options. The other, especially for children's, that we are doing work with parents is having the parent group and have an open conversation, how we can improve services, what is your needs, how we can be better, and really creating this space of trust to hear and see what they need.
Thank you so much. I'm going to move us into actually the next question. So let me just get that started. My next question is, what did you hear about the needs and how did you respond? What challenges did you identify and how did you address them?
I can also jump in that one. One of the things that we are hearing a lot is really hearing is about having a holistic approach of intervention, because what is happening right now is sometimes we do, okay, you have we can serve you with a mental health intervention, and then I have to go transfer to the or connect into the maternal health department, and then with the diabetes, depending on the needs. So I think one of the things is it's hard to navigate systems. So how we can have a holistic approach to serve a family, and I think that will be a cost effective. We don't have the solution, but I think that's a need that we hear from the communities. Having a centralized place for have a holistic approach intervention, so they don't have to go from one place to another place, waiting 3 weeks to be seen. That's kind of so we're trying to do kind of this holistic approach in our centers. You know, like, okay, maybe having everything in a place is hard. And I just want to share that one of the things that we hear.
Absolutely. And thank you for that. You know, it makes me kind of think about the next question, because so many of you on the call are doing great work in your organization, but you know that you can't do it all alone, right? Communities need each other, and so do partners. And so the question is, how do you collaborate with other organizations to maximize impact?
Thank you, Jessica. I'm gonna kind of intertwine 2 and 3 together because I had some thoughts as Alex was talking as well. So for us, we heard the urgent needs for interventions that address not just individual health behaviors, but the broader systemic and structural issues contributing to health equities. And so the BIH program's response has been multifaceted, targeting the root causes of poor outcomes, such as structural racism, chronic stress, and lack of access to quality, respectful healthcare. And so our comprehensive approach also emphasizes the importance of cultural heritage, stress management, and healthy relationships in our group sessions, ensuring, much like what Alex was talking about, a holistic approach and an empowering approach. And so kind of pivoting into collaboration is integral to maximizing the impact of the Black Infant Health Program. By partnering with healthcare providers, mental health providers, and other community-based organizations, we create a robust network of support for Black mothers and infants. And these partnerships enable us to be able to provide comprehensive services to the families that are enrolled in the program. And so partnerships also allow us to help with challenges that some of our participants face, from healthcare access to socioeconomic barriers, thereby ensuring, once again, that holistic approach to improving health outcomes. And I'll go ahead and hand it over to Maya to give you a little bit more.
Oh, Maya, there you go.
Similar to what Renee was saying, identifying the barriers. So it's specifically to our team, we have our group and one-on-one that family health advocates take care of. We also have a mental health professional to help with the mental and emotional status of our moms. And then we have a public health nurse that helps with like the physical prepping for birth, also caring postpartum. And then some examples of how we collaborate. So for instance, we have a sister program that's called Safe Sleep Baby. This helps educate our moms on how to safely sleep their infants. And then we are able to provide cribs if they're in need. And then another one specific to Sacramento County is our 9 family resource centers. So this can help families with additional support. It can also focus on additional children in the families because Black infant health is more so specific to the mom and then the infant that they're bringing into the program. So whether that be prenatally or postpartum.
I can also one of the things that we have been doing is really having a partnership with the cultural sensitive groups. Because we have been finding out that even though we have someone that speaks English, as an example, but maybe they are from the Asian community, they are more effective. So the service will be more effective if I am able to partner with an Asian American community to do the service or to do the intervention. So I think creating these cross-cultural or intercultural partnerships too are going to be super effective. Even though even in our Latino community, if you have someone that are from different, that they speak in Spanish, doesn't mean that they are cultural sensitive or cultural. So I think that's super important to be effective in the interventions, especially with our communities. The English is not enough in order to do this work. And then I think that the model of the CHWs can be they can hire from their own community and integrate this model within their own agency to do the work in different the intercultural aspects. Yeah, I just want to highlight that part too.
No, thank you for adding that. We appreciate that. All right, so we are halfway through our questions, but the next question is, how do you fund your services?
That's the question of there is, as a community-based organization, we struggle. We struggle to get services. So we have government grants, we have philanthropic supporters, we have private donors, and we are trying to move forward to the fee-for-services kind of. Definitely, everything is free for the community. We don't charge, but I think that's kind of the challenge. One of the things that we're trying to explore with the board, with our board leadership, is to bring local businesses to be engaged in our mission, so they can share their worth, some funding to some of the projects. So okay, well, you don't help us to support this project that aligns with what you are doing. So I think is that the challenge that we face. The other challenge is about government funding is 1-2 years and then ends, and now I train these many families, all these CHWs, and we are serving these many families, and now I have to, hey, sorry, I don't have any more funds. So how we can sustain the level? So I think it's a big project, a big question, but I think we need to start thinking out of the box and not depending on grants, and we have to mobilize to that direction. I don't know the answer. Maybe someone from the audience can have some ideas, but I think that's something that we are daily exploring, how we can sustain our programs with no fund, no depending on grants.
Sure. Thank you so much for sharing that. Let's see. So I'll move us on to our next question, which is, how can the lessons you learned be expanded to other communities and populations? Maybe there's some folks on the call that are looking for some best practices or just any lessons learned. Does anyone have a thought?
I think, some of the lessons learned is like the importance, and speaking just from the Black Infant Health Program perspective, is addressing the structural detriments of health is very important, but community engagement, getting feedback from the community and the people we are serving is very important when providing services to any population. And so therefore having culturally relevant services. And I think just being more of listeners is crucial.
Absolutely. Thank you so much. Alex,
No,
any
I can,
thoughts?
yeah, I think is really having the community on the table, as Renee mentioned, but not just to all what you need, but so they can also provide solutions and be part of the solution. So I think is getting them on the table, and they can be, because I think we need to also create self-sufficient communities. So I think that process, as we do the community engagement, they can start finding their own solutions. For example, one of the projects that we were having was a postpartum depression, and they have like a groups, and then the funding ends, but now how we can make a self-sustain this group moving forward. We know the facilitator, we know the fund. So I think that the process also can help us as we do the community engagement to self-sufficient communities, so they don't depend on, they can find their own solutions. And then I think that because they own it, they embrace it. This is my solution. It works for me. I want to do it, and this is my. So I think that's something to keep in mind as we bring solutions, or at least facilitate the conversations with the community to find their own solutions, because
Absolutely.
each solution is different for each person. Yeah.
I agree with Alex. Yeah, they become more invested, right, in it if their voices are being heard and appreciated and valued. That is fundamental to providing any services to a community, and then it builds trust. It builds trust as well.
That's great. Thank you so much. And this is actually the last question. The last question is, how do you ensure that your services are accessible and inclusive?
Thank you. So ensuring accessibility and inclusivity is at the very core of the Black Infant Health Program. We achieve this by offering services, for one, at no cost. There is no cost to be a part of our prenatal or postpartum groups or receive the one-to-one support. We provide transportation assistance. We provide cribs to those who complete the Safe Sleep Baby education and don't have the ability to get a crib and need one. We provide car seats, breast pumps, so many different things for free. There's no charge for any of those things. And we ensure all our materials and sessions are culturally relevant and reflective of the community we serve, which is very important. And our staff is also trained in cultural competencies, so which is critical for delivering respectful and effective services. Maya?
I was going to touch on how we, like, the accessibility in the last 4 years, given the pandemic, also had to be altered tremendously. So making our groups virtual so moms could hop on Zoom when the world shut down, and being able to do door-to-door deliveries when you couldn't really have contact, and having virtual incentives if we had to. And then that has also carried into coming out of the pandemic. It's still allowing us to reach our moms where they're at. So a lot of prenatal moms are still working. They can hop on a Zoom during their lunch to listen to group. Some moms have to pick up their other children from school during the afternoon. So just kind of meeting them where they're at, making sure that they feel included. And now that we can transition into in-person things, and we can actually include them in that as well. But just meeting them where they're at and tailoring it to them where we have to is a really big part of how we do our work.
You know, as you say that, it actually kind of reminds me, we wrap around to the first question again, right? The question of how do you identify the needs? And then once you've identified them, how do you help to meet those needs? And, you know, today's conversation is really about prioritizing community support. So I feel like what you're talking about is we identified how could we modify, adjust, what would it look like to better meet the need that they have right now, like that Zoom or the drop-offs. And I find that in many cases, for those on the call and as you're listening, it's a good question to think about. How these questions that we've posed the panelists are great questions to also be reflective of, thinking about How do you identify the needs of the community you serve? How do you ensure that you're meeting those needs? And hopefully today's panelists have given you some ideas and some best practices that you might be able to absorb into your agency. I wanted to give all panelists an opportunity just to make sure, no pressure. Alex, did you have anything you wanted to add for this last question about ensuring services are accessible and inclusive?
I just want to get a few a story they have maybe 10, 15 years ago that the director of the mental health department called me and say, Alex, this community is having issues with the mental health, so forth. Can you help us with this community? So I give some advices, and then they went get information from the community, and they built a nice mental health facility. But a year later, they called me again, Alex, what happened? No one is coming to this. And then I started getting more into the community, going to talk to them, having coffee, what happened. And then I find out that what the department did was just have a service and a focus group. Hey, I need this. And they provide the services, what the community asks. They provide the facilities that the community asks, but the community was not part of the delivering of the services. So it was a community, they have the facility was open from 9 to 5. The community were not able to come because they have to work. So I told them, you got to change. If you got to get more people, you have to change your time. And they move it from 12 to 8 and Saturdays open. And that just start changing. The other thing that was about how was set up, they painted, it was more like a hospital. And then I told them, hey, who choose those colors? Who make those decisions as a clinic? You should be. So they get the community involved. They change the entrance more friendly. 2 years later, they call me back. And then actually we have a conversation. Hey, how's everything going? The numbers start getting the intervention. So I think we have to believe in the community. We have to trust them. They are the ones who needs to drive this. Their solutions and change everything. So they just, yes, we do a focus group and we do a survey, and that's the needs assessment. That's how everyone is telling, oh, this is a needs assessment. But when you do the intervention, they're not part. So I think inviting and not just making decisions. How do you want to have this table? How do you want to get? So they own it, they belong, and they change it now. It's a mental. It's not mental facilities, it's a wellness facility. They change the name, they change everything. So I think that's kind of my message. And they incorporate community members, leaders, to be the ones in the front desk. No one from outside of the community. They become so they integrate the promoter, the CHW, as the core of the members of the community being leading there. I just want to give that story, so hopefully I can illuminate a little bit more of the questions, answer to the questions.
Yeah, no, we appreciate that example and that story as well. I think it really highlights what I've heard as a central theme throughout your answers of the impact you can have through asking and listening and identifying and meeting needs.